fact of life is busier now. It's busy for all of us. So you can't tell a 22-year-old, go and find Mr. Right and have a baby. But what people have to understand, and I'm constantly surprised by the fact that biology courses don't teach every single girl and young woman that you've got a finite number of eggs, you're losing eggs from the time that your mum is about halfway through the pregnancy with you. So that age is everything. So the older you leave it, the later you leave it, the worse it becomes. So people have to know that, and then you make your decisions according to that knowledge. So if you wait and say, right, I'm going to worry about my career until I'm age 38, that's fine, as long as you realise then your eggs are 38 and a half years old.
I think the advice in terms of when to have a child should remain, if you're in a good relationship, in a loving relationship, and you plan to have children, what are the really good reasons why you're not having a child now? If indeed there are really good reasons and you've been able to articulate them to yourself and within the relationship, there may be a place for preserving your fertility until that time when you know that you will be ready.
People think, oh, I'm going to make money, or I'm going to be successful, or I'm going to have a happy life, but we don't have a lot of control over fertility, whereas we probably do over our careers or our pathways that we choose.
Biologically, thanks to the fact that those eggs have been there from the day that woman, that little girl, was first born, the age is everything. So really the other way to put it is that we know that fertility halves from age 30 to 35, halves again from age 35 to 40.
I think that there's an awareness in the community that eggs age as the woman ages. However, most people don't think it applies to them. They're aware of the statistics of the general population, but know that because they've kept themselves fit and eat a healthy diet and don't binge drink and don't drink too much coffee, see the naturopath and have acupuncture, that they'll be fine. Unfortunately, the ovaries don't know anything about that, and they just march to their own drumbeat.